Cloudnine Hospitals. Me, Dr. Pooja Thukral. I'll be talking about Pap Smear. There is a lot of information already available, and I have also spoken about Pap Smear earlier. But I thought like a reiteration is important because there are a lot of women who still go without getting a Pap Smear done. So who should get a Pap Smear done? When should you do a Pap Smear? This is what I will be talking about. So Pap Smear is basically a screening test which is used to detect any inflammation, infection, pre-cancer or cancerous lesion of the cervix. Now when I say cervix, what do I mean by cervix? So if you can see in this model, this is the uterus and the mouth of the uterus is known as cervix. Now a lot of patients, they confuse it with this cervical. When we talk about cervical ka dard hai. So this is nothing to do with Pap Smear. So Pap Smear is basically a screening which is done from the mouth of the uterus. So we are screening for any pre-invasive or cancerous lesion of the cervix. This is cervical spondylosis, so two separate things. Now the next question is, when should you initiate doing a Pap Smear? So we should start doing a Pap Smear according to the Federation of Obs and Gynae Society of India. We should start doing the Pap Smear at the age of 25 and we should continue it up to the age of 65 years. How frequently should you do a Pap Smear? So if you're doing a cytology, which can be a Pap Smear, conventional Pap Smear or a liquid-based cytology, then you should do it every 3 years. Now with recent advancement, we also have a facility to detect HPV virus. Now human papilloma virus is the culprit which is causing cervical cancer. So if we use a human HPV DNA detection along with the cytology, then we can do the screening every 5 years. So I'll just repeat it once again. If we're using a plain cytology, then it has to be done every 3 years. We start at 25 and we stop at 65. If we're using a HPV along with the cytology, which is called as a co-testing, then we do it every 5 years. So the duration will be same, every 5 years up to the age of 65 years. Now in between, if a lady undergoes a hysterectomy, which is a removal of the uterus, then we stop doing a Pap Smear screening unless and until pre-surgery it was suggestive of any cervical intraepithelial neoplasia, or after getting the surgery done if there is any evidence of pre-cancer or cancer in the specimen which was removed. So this was about when should you start, when should you stop and how frequently you should get it done. Now you have to go to a gynecologist to do a Pap Smear, and I thought I'd just show you simple instruments which are required to do it. So with a gloved hand and under sterile aseptic precautions, this is the instrument which is a speculum which we put inside the vagina and open it to look at the mouth of the uterus. The procedure takes just 5 minutes. So you put this, you open it, you visualize the mouth of the uterus, and this is a brush. So you just scrape the mouth of the uterus. It doesn't cause any pain. You scrape the mouth of the uterus and the sample is collected in this jar, and that's it, it's done. So in the same jar and with the same specimen, we can check both for the presence of any abnormal cells, that's what I meant when I say a cytology, and we can also detect the HPV virus. So it's a simple test for all those of you who have not got your Pap Smear done as yet. I would encourage you to go and get the Pap Smear done and encourage your sisters and mother to do it as well. Thank you.